So what we actually did is we compared the new IQ Fish technology of Darko with the Path Vision fish technology of Abbott and the dual color, dual in situ hybridization technique of Ventana, or shortly called ZISH technique, silver stain in situ hybridization. And what we did is we compared the amplification status of Her2 gene, and we also looked for the quality of staining, the handling, and the workflow. And we divided our study in two parts. One is a feasibility, we called it feasibility study, with 50 initial cases, and then we, after setting up all the procedures in the right way, we also expanded our study with another 150 cases. And of course, the distribution of specimens was aligned to what we see in the real world. That means about 20% positives and 80% negatives. And you will see we had quite a lot of cases in between the so-called equivocal cases, in order to assess the validity of the new technology and robustness and reproducibility as well. So, first of all, we compared the Her2 gene status as defined by the ratio values by the three technologies. We also looked for the success rates, and finally, we will address performance, quality, handling, workflow, how it fits into our routine lab, routine diagnostics. So, as I mentioned already, the first set was 50 cases where we preset the concordance rate to 95% in order to make sure that everything is correctly settled, and then we did the test phase where we use both biopsies and surgicals, and these were taken from two sites in Germany, from Kassel and Cologne. So the procedures applied followed the manufacturer's manual, so and I will go to the details later in my talk. And after the people in my lab had been an on-site lab training, we went then to do all these three technologies and to compare them. And the evaluation of the slides was done by three pathologists, and in all cases where we had equivocal results, these were reviewed by another expert in ISH reading, namely Iris, who is in the audience here, our gold standard in ISH reading. And finally, the ratio was, the cases were classified by ratio. So after scanning the tumor and identification of a representative tumor area, 20 cells in one or two representative areas were counted, and the ratio, the Her2 chromosome 17 ratio was calculated, and in those cases where the ratio was in the equivocal range according to ASCO-CAP guidelines, another 20 cells were read, and then the final ratio was calculated, and if it was equal or above 2, the case was called positive or amplified, and non-amplified in case it was less than 2. So the first feasibility phase resulted in a quite good concordance rate, both between IQ Fish and Path Vision, with 96%, and also a quite nice concordance between IQ Fish and ZISH, with 95% concordance rate. And this was then due to a real quite good, very good quality. You see here the comparison of the IQ Fish stained cases with the Path Vision cases and the ZISH on the right side. And you see that the the nuclei, due to a very intense DAPI stain, the nuclei show up with a very bright, clear outline and staining, and the specific signals, the red Her2 signals, as well as the green chromosome 17 signals, are very distinct and quite easily to read, both in the non-amplified and clearly visible here, even better in the amplified, where you see the clear difference to the path vision fish, where you have, due to the filter set, a more reddish background, which really makes much more difficult to read the specific gene signals. And on the other hand, you see the silver technique, where the black dots comprise the Her2 specific signals and the red dots the centromeric 17 signals. So that means, in terms of quality, the new IQ Fish technique really comes up with a very high quality staining, brighter stained cells, easy to see morphology, easy orientation in tissue at low magnification, and due to the real robust and green and red signals, as shown here, this allows a precise counting of the at high magnification, and of course a more easy to selection identification of the relevant cancer cells. So based on that, we went further and increased the number of cases, and again this turned out to have a very good correlation, a perfect concordance between IQ Fish and path vision, and almost perfect correlation between IQ Fish and the ZISH technology. If we look to these seemingly sort of discordant cases, 6 cases in more detail, then this is the raw value scatter plot. Then you see that this is obviously due to the fact that we had quite a lot of cases in the borderline range, means ratio values between 1.8 and 2.2. So this is, I think, always also in routine and in practical performance, it's not the clear positive case, it's the borderline case that makes trouble and causes discussion. And you see that there was more overlap between IQ Fish and ZISH as it was between IQ Fish and path vision. And if we go to the details, then it clearly comes up why was there such a, let's say, sort of discordancy. And the answer is, if you look to these 6 cases, 4 out of the 6 had a polysomic status. That means the chromosome 17, the centromeric 17 count, was above 3. And in those cases, according to ASCO-CAP, you should not only use the ratio value for final decision, you should also look for the gene count. And if we look to the gene count, it even becomes more evident that 5 out of these 6 cases came up with an increased gene count, either in the borderline range, again between 4 and 6, so 5.7, 5.6 and so on, or like this case that showed a clear increase of the gene count even above 6. So this case is, according to the ASCO-CAP guideline, although the ratio might be even negative, is a positive case. So that finally clearly shows that those seemingly discordant cases in fact can be resolved if we look to the centromeric count, to the polysome, so-called polysomy, and if we take the gene count into consideration. So at the end, from the diagnostic point of view, we have a very good high-level concordance of the IQ Fish with other ISH technologies. So this is again very nicely presented here in this slide, where we have where we put together the polysomic case without amplification but increased gene count. This is the one where we had clearly above 6 gene counts per cell on one hand. So, and the other polysomic case, non-amplified, with again increased gene count in the borderline range between 4 and 6. And the most important point is, if you compare these slides, these figures, then you see it's really easily, much more easily depicted that these cases are polysomic or so-called polysomic with increased centromeric 17 signals, but also you can easily recognize the gene signals. Here it's clearly above 6, but here it's in the range of 4 and a little bit more. So that is particularly in the difficult cases, polysomic, borderline cases. So this technology is really a step forward. So now to the end point of success rates. As you see here, on the first one we had a little bit increased failure rate in all the technologies, but it turned out that we had, due to the fact that 50% of cases were biopsies, and in biopsies we also know that these might be over-fixed. So that means if you have a longer fixation, maybe over a weekend, that has to be considered during your procedures. So what we do, we increase the digestion time. We take a 2 times higher digestion time in cases where we know they were fixed over weekend, for example. And you see that clearly increases the efficiency rate, which was finally around 95% in all these technologies. And now the question is, what are on the background of good, excellent diagnostic value, what are further pros and cons for the 3 technologies? And there we can see there are mainly 2 important points to be considered for IQ Fish. One is the use of non-toxic ethylene carbonate, and I think I've seen Beppe will go in that in more detail in his talk later on. And there is an amazingly short hybridization time, which is 1/10 of the pass vision and 1/3 of the ZISH technology. And together with the already shown high quality, so we have a technology that has a very good performance. Due to the rapidity of the performance, this fits very well to the workflow. And again, that means if you probably see in the morning the IHC, score it 2+, you decide, okay, I need an ISH, you may even get the result on the same day using this technology. So in sum, we can look at this new technology as a reliable method to quantify the Her2 gene amplification status, thus to identify the right patients for the right therapy, the Her2 directed therapy. And of course, this applies for breast, not only for breast, but also, or I would say even in particular to gastric cancer, where we have to deal with heterogeneity. So you need a good technique where you readily see the variation in your slide, in your tumor. And as we all know, cancer patients are usually seriously ill. They come up to the clinician with an advanced cancer disease and they need immediately to be treated. So in these patients, time matters. And so at the end, I would like to thank for your audience and look forward for questions or discussion later on. This depends on you. I give it back to Beppe.